So welcome everyone to Morgan's Medicine. Again, this is our second podcast. Still not 100% sure about the name, but we'll go with it for the time being. Today's guest is Dr. Dameron. We're going to get into a little bit why we thought that he would be such a special guest for us to have on our second episode. So before any further ado, Dr. Dameron, thank you so much for coming by and letting us sort of ask you some questions.
Thank you for having me here. I appreciate the opportunity.
You're running a regular practice the way that it's been done for decades or whatever. It gets to the point that you realize your care may be diminishing just because of the financial burden that's on your practice. You've got to see a certain amount of patients in order to do that. So what did you do?
Well, one of the things you touched upon is, a lot of doctors are overwhelmed and patients can't get in. I myself, as of December last year, was booked out 9 weeks. So patients would call and they would say, hey, I'm sick, and they would say, well, we'll put you on a cancellation list, but unfortunately Dr. Dameron has no availability. And that's horrendous. If you're sick, you need to be seen today, and certainly if you can't get in to see me, then it defeats the whole purpose of having a doctor in the first place if you have to go to a walk-in clinic or an ER or whatever. So I looked at it, and I talked to some doctors in the area, and what I actually decided to do is to come up with a practice model. I call it concierge because it's something that people can kind of wrap their heads around, but the actual model is called direct patient care. The difference between a direct patient care and a concierge model is in a concierge model, traditionally, you bill the patient and their insurance. There's a membership fee the patients pay in order to be part of the practice, and you give them certain benefits of being a member of the practice that go beyond the typical care you would give in a normal office that bills only insurance. For instance, same-day appointments, smaller practice size, so greater availability to get in to see the doctor and what have you. A direct patient care model, the DPC model, is a model where you don't bill the insurance at all. I do encourage patients to have insurance because I think, for those catastrophic things, God forbid, the person has a heart attack, winds up in the hospital, they're going to need that. Certainly with help with some of the costs of some of these medicines today, they're getting out of control. But in terms of needs in my office, there's a simple membership fee they pay. They can pay monthly, quarterly, annually, however they want to do it. And it costs less than what you would pay for an insurance policy. And in fact, I saw a girl yesterday in my office who was going to go to a walk-in clinic, and her entire month of seeing me is less than one visit she would have paid at the urgent care clinic yesterday to be seen for an injection, which I did in the office.
Absolutely, and she's got access to you.
Yeah. So
24/7.
We basically set our practice size to 300 patients. So I notified all of my 4,000 patients, and I gave them the opportunity to join. Some were excited, some not so much. It was a difficult time, and it's tough because you build relationships with these people, and they're like an extended member of your family, so you miss them. I'll go out to restaurants and I see them in restaurants and stuff, and they tell me they miss me, and vice versa. But the 300 patients allows for a very open schedule. So if a patient calls and says, I'm sick, they can be seen today. In fact, I've seen patients within the hour. Come in right now, we'll see you right now. And at worst case scenario, if it's flu season and we have 15 people on our list, it'll be the next day. It also allows me now the time and availability that when my patient's hospitalized, I can see them in the hospital. If my patient is incapacitated, let's say they break their leg and they can't leave the house, I can drive to their home and see them. I have a woman that I see who's in a nursing facility. I have another one who has dementia and can't drive, and she's right around the corner from my office. I see her at her house. So it allows a lot of flexibility in my scheduling, and it really provides very good care because now, with a much smaller patient base, I can actually focus on the patients, know them, who they are, what their medical problems are, what medicines they're on, and they have 24/7 access to me. So if they call, even if it's after hours, the phone rings to my cell phone. So they have that availability to get a hold of me even when the office is closed.
So first thing is access that they've got. Any time of day, they can call you. They've got you on the phone, and you can direct them whether this is something that you need to see them for.
Correct.
Hey, this is probably something that can wait till tomorrow morning, and we'll address it then.
I've had a couple instances. I mean, I was in my office several weeks ago. I had a guy at 11 o'clock at night on a Sunday night cut his hand open doing dishes and needed stitches. I met him at my office. I sutured him up. There was no additional charge because he pays his membership fee. He came with his, it's neat to see how this type of model impacts people. This guy had come with his 2 daughters, one is 6 and one is 7. It's 11 o'clock at night on a Sunday, a school night. And I can only imagine, being a father myself, the idea of not only bringing my children to an emergency room where they're going to be touching things and crawling around, but on a school night at 11 o'clock, there's no guarantee he's going to get right in there.
Absolutely. Or they're going to wait for 5 hours to get his kids home at 3 o'clock in the morning and then the next day.
I was at my office in less than 20 minutes. His stitches were done in like 35, and he was home in bed with his kids.